This episode of the Oral Health Podcast is brought to you by the Wrigley Oral Healthcare Programme. We'll link all of their information in the description below. Hello and welcome to the Oral Health Podcast. So in connection with National Smile Month, we are bringing you bite-sized discussions from different people in dentistry about oral health and a wide variety of topics. So today we're going to be talking about how we can take care of our oral health ourselves. So today I am joined by not one, but two guests. We've got Tim Newton and Avjit Banerjee. So the world that we're in is changing all of the time, of course, with a global pandemic and now hopefully coming out the other side of it. What we did 12 months ago is now very different to what we do now, not just in dental health, but in absolutely everything. And that disruption in routines could cause potentially some of us to forget to do things or not do things as often, or just because our routines have been disrupted. So one positive though to come out of the pandemic is that our healthcare attitudes are shifting more and more towards prevention. And so preventative dental care will mean things like brushing twice a day, flossing, mouthwash, sugar-free gum, things like that, things that you can do yourself to take care of any problems, potential problems, I should say, before they actually manifest. So, Tim, what things would come under preventative care? Have I missed anything?
That sounds like to me like you've covered everything there. The message is relatively simple. There's brushing your teeth twice a day, cleaning in between, so floss and interdental brushes, which you mentioned, using a mouthwash at a different time to when you brush your teeth, chewing sugar-free gum, and trying to cut down on those sugar-containing snacks.
Yeah, I'd agree. And I think a point that was made that the pandemic has had obviously lots of negative impacts to people, but potentially the awareness of people's own health has increased, and I think that's something we can use to our benefit in terms of talking to the public and talking to patients and engaging with them. So on top of what Tim has just said, it's being able to reinforce those messages and enabling them within their lifestyles and the change in the lifestyle that they've experienced to practice sort of preventive oral health care.
I'd agree that the pandemic has been, enormously disrupted. That's so obvious, but actually, it also provides that opportunity to kind of rethink how we've been doing things, and both in the way we deliver dentistry, but also perhaps personally how we look after our teeth, and try to kind of see whether we can modify some of the things we might have got into habitually, add some new habits, make some new changes. So I think it's also an opportunity to kind of disrupt what's been going on previously and do something new.
Being on Zoom calls all day, I am looking at my teeth all the time. So I think that, if anything, could urge people on to maybe go, oh, I need to brush a little bit more there. Or, oh, God, my gums look a bit weird, so I better floss today. Or you can get motivation from unlikely places, I guess.
Yeah, absolutely.
Agreed.
What would you say, because you mentioned habits and routines, has the way that you talk about preventative care with patients, has that changed significantly because everything has changed? Zoom appointments instead of going in?
If I kick off with that one, I think, do you know what, the actual prevention messages haven't changed. I think that's actually quite an important point. The underlying messages have always been pretty much the same. I think the emphasis, and as we've already touched on, the awareness from patients is something that we can use to our advantage. And obviously the sort of logistics of being able to see patients in a dental clinic, and the fact you mentioned that there's been more sort of teledentistry, using computer screens and phones and things like this, means we do have to rethink how we deliver the message. So, but as Tim's alluded to, we use that to our advantage. And I think what's key is about engaging patients to appreciate the value of their oral health. And I think the fact that patients have not been able to go to the dentist so easily and get appointments and things like that has again potentially increased the priority of their own oral health in relative to everything else that's happening in their lives previously. So I know we're trying to put a positive spin on this, but I think this is the chance for us to be able to do that. I know, Tim, what do you think about that?
My take slightly different. And there's a kind of theme that's coming, which is that actually it's always been true that the role of the patient in looking after their teeth is absolutely critical. But actually, I think because there's been less access to dentistry during all the various lockdowns, it's become more apparent to patients. And so that really creates that opportunity to say, well, now you really get it, that actually you're responsible for your teeth 365 days a year. So what you do is massively important. How can we help you think about and plan to make some really, really healthy choices?
It's at the end of the day, it's as dentists, you can do everything, but it's not your teeth at the end of the day. When someone leaves the chair, it's on them, which I think, just talking from personal experience, sometimes it gets a little bit lost on, oh, I can just go back and, oh, it's not a big deal. I don't brush every day and I've never had a filling, so clearly I don't need to do it. And that's just absolutely not the case. It's just pure luck if you don't brush and you've never had a filling or you've never had a gum issue. It doesn't mean that it's not necessary, but that could sometimes maybe be lost on people. I know it probably is on everyone at some point. We've all skipped a brush here or there. The best will in the world. It will happen. But is there anything apart from just brushing, flossing, any other things that someone can do to avoid things like erosion or decay or staining, or is there anything other than that they could do to avoid it?
I think one of the key areas, as well as you mentioned in terms of the hygiene methods of brushing and flossing, is to look at what causes those problems. So if we're talking about erosion that you just mentioned, or where the teeth sort of erode away because of the acid that's within the food and drink that we consume, it's to have that awareness. And I know there's a lot of industry now that are starting to give us that information on packaging and in TV adverts and things like this, which again is a really positive sort of message to get out there to the public. But I think there are simple things that all of us can do. So if you do have acidic fruits, for example, your citrus fruits, your oranges, your lemons, your apples, things like that, or fizzy drinks, which are classically the acidic ones. First of all, it's very easy to say, oh, stop eating and drinking these things. That's not what we're saying. You can have, I think everything in moderation is a perfectly legitimate philosophy to have. But I think the key thing is, if you're going to have something acidic, try to avoid mechanical brushing or flossing of teeth immediately afterwards, because the surface of the tooth becomes a little bit softer. And if it's softer and then you're rubbing it with toothbrush or something like that, you can cause more wear quite quickly. So we often advise to wait at least an hour after consuming these foods, or at least try to rinse your mouth out with water, with just normal water. That's another way that will sort of dilute the acid in the mouth, and therefore you won't have those sort of harmful effects. And with tooth decay, I mean, the key dietary factor, as I'm sure most of us know, it's sugar is the critical bit there. And again, it's understanding what sugars are in foods. Again, that's a lot more complicated. There's no doubt about that. And it's not a simple equation sometimes. But again, in moderation, and then making sure that at least twice a day, either, beginning of the day and at the end of the day, that you spend, a proper length of time, a couple of minute careful brushing, that can all help.
So, because, people, I know I've definitely thought this at one point of 2 minutes is too long to be brushing your teeth, but actually no, when you do every side and every tooth properly, there's no way that it could take any less than that. If you're not doing it for long enough, it's because you're not brushing everywhere that you need to. And one of the things I know, when I started working with the foundation, because I'm not medical, I came in with very, very little dental knowledge. The disclosing tablets, I know I've used them and just went, oh God, that is grim. All of the places that you don't realize you're missing, but you clearly are. And then they can really help point out those problem areas.
They can. And I mean, a lot of people don't like using them because they're quite messy And, you know, and I think that's also really actually quite important in terms of motivating people to you know, to use the correct practices. And, you know, live in a very technologically enhanced world, and more of our gadgets that we can use, our electric brushes and things like this, all are now coming with apps and bits of software that will give you some of this guidance. And for, you know, some members of the public, that actually is quite a motivational way of using tech. And the other thing is, put a radio on, play some music, you know, listen to a podcast or something, and time it for 2 or 3 minutes, and that sort of helps you time, you know, the amount of you know, that the time you're spending on cleaning, and working with the dental team, the oral healthcare team, when you go and visit the dentist or the hygienist or the therapist, you know, to help them make sure your technique is right.
If I had one very quick piece of advice, it would be, following on from what Avjit just said, actually, is when you next go to your healthcare team, your dental healthcare team, ask the dentist or the hygienist or the therapist or whoever you meet, just say to them, where I am now, what's the best one thing I could do? And they'll give you some advice. Rather than telling you everything you need to do, they'll give you some advice about what that one thing you could do, what the one change you could be. Then really work at that. And then when you go back, say, well, you know, done that one, what's the next thing? Rather than trying to change your entire routine, which is a bit what happened to us all during lockdown, at once, see it as a long-term commitment to gradual change, working, as Avi said, with the dental team together.
That's a good point, because it is going to be different for everybody. Not everyone's going to have the same, I don't like to use the word quick fix because it's not a quick fix, but the same one thing. With like sensitive teeth, is there anything different that you need to do with sensitive teeth?
From a sort of practical point of view, it again is the cause. It always is going back to the sort of root cause of the problem. And often that might be dietary. Again, acidic food and drink can sort of essentially soften the surface of the tooth and open up, so if you like, little holes in the surface of the tooth, and that can then trigger that sensitivity towards the center of the tooth, where the nerve and the tissues are inside the tooth. So it does then make it sometimes exquisitely painful to brush your teeth and clean them, and that then becomes a turn off for the patient, quite understandably, and that you can then see triggers a whole negative sort of, you know, run of events. There are products that are out there at home that you could use. There are sort of toothpastes that are actually promoted to sort of desensitize teeth, and you know toothpaste used for sensitivity, and all the different manufacturers produce their own sort of version. The toothpaste won't work overnight. You have to use it gradually over time, and then you will start to notice that the sensitivity will ease. And also you moderate the cause, i.e. the diet, for example, that might be causing that problem. But again, it links back to what we just said earlier, that you then go and speak to your oral healthcare team, the dentist, the therapist, the hygienist, because there are things that they can also do if it's really, you know, acute.
So my one thing which I say to people with sensitive teeth is think of it like a night cream that you might put on your face at night. So what I recommend is, before you go to sleep, smear some sensitive toothpaste onto the teeth that are sensitive, and then don't do anything.
Just leave it on.
Just leave it on overnight. And it doesn't work overnight, but over a few nights, what you're getting is like a smear of sensitivity toothpaste working away.
Okay, that's interesting. Just very quickly as well, just to pop in there, because this episode is sponsored by Wrigley, who make lots of fantastic sugar-free gum, and that sugar-free gum and chewing it can help your oral health. How does it help your oral health? What is it actually doing? Essentially,
you have a whole host of different effects. So you've got the chewing effect for a start. So if you're actually chewing, for example, after a meal, food debris and things like that can actually get dislodged and moved away from the tooth surface. So that's actually beneficial. The chewing effect stimulates the human body and stimulates the mouth to produce more saliva. The saliva has a washing effect around the teeth. So again, it can dilute the sugars, the acids, and things like that that accumulate after a meal. The saliva also contains lots of really clever, good, ingredients inside itself, which can also help strengthen the tooth. So these are all real positives there, okay? The gums, depending on the type of sugar-free gum, they actually may also contain ingredients that may be slightly antibacterial, or prevent the bugs that are in the mouth from sticking to the tooth. So there's a whole host of ways that by chewing a sugar-free gum, even just for 15, 20 minutes after a meal, can be beneficial overall to oral health there.
What I like about sugar-free gum is it's so easy to do. So it's such a easy intervention.
So it's like a tide over through the day. If you've had something that I don't know why, the only example I can think is spinach, but if you have spinach and it helps to get the ick off your teeth, for lack of a better term.
And most people aren't going to carry a toothbrush and toothpaste around with them in their pocket all day. And therefore, as Tim says, you are going to eat and you're going to drink, or certainly after having a meal, after lunch, for example, if you're at work, chewing a little tab of sugar-free gum for 20 minutes, even quite discreetly, can be done. Dispose of it properly, of course, and that's very important from an environmental point of view, but it has genuine and proven benefits. There's been lots of research and clinical studies and things like that have shown that the benefits, are there and can be manifest quite well. The only last thing I'll say as a summary is, and Tim alluded to this earlier, is that with what's happened in the world and what's happened in people's lives, I think that the understanding and appreciating the value of oral health has, I think, potentially come up the list of priorities for some people, obviously not necessarily everybody. And I think that's a positive. And I think we as a profession can work with the public to sort of engage with that more and more to sort of instigate that change in prevention.
Yeah, it's the Oral Health Foundation did a study for Smile Month where we asked a lot of different people across the country questions, and a very surprising amount said that they've actually increased the amount that they're brushing. They're not forgetting to do the nighttime brush because they're not coming in tired from work. And I think it's important as well to look at some positives that could have come out of the last year, because there are few and far between.
Share your goals, because having social support and the kind of social recognition that you're trying to change your behaviour really helps.
Well, it's been so lovely to sit and talk to you. We're going to wrap up for today. Thank you both very much for joining me. Keep listening in for more Smile Month podcasts, as we're going to be releasing them throughout the next few weeks. Tim and Avjit, it's been lovely to talk to you. Thank you for joining me, and we'll see you next time.
Thank you.
Cheers. Thank you.